Good evening, all. Welcome to webinar on application of simulation in healthcare by Indian Society of Emergency and Cardiac Nurses, along with NASA's initiative for community empowerment. That is nice. And today we are having Abdulaziz as the speaker. So before going further, I would just want to give you some brief idea regarding Indian Society of Emergency and Cardiac Nurses. Many of our participants are familiar, well known about Indian Society of Emergency and Cardiac Nurses, but still, I just want to give a small description about our society. Indian Society of Emergency and Cardiac Nurses is a non-profit professional society meant for organizing seminars and training sessions with emphasis on skill-based workshops, health-related panel discussions, and conferences primarily for professional nurses, other healthcare providers, and the community. We are conducting various webinars, long and short modules. Some of these are paid and others are free of cost. And today you are attending a free webinar. The income generated from the paid courses are used for the day-to-day activities of the society and for the welfare of fellow nurses by various means, including free skill enhancement programs, scholarship programs, and research assistance and grant. And along with the Indian Society of Emergency and Cardiac Nurses, the Nurses Initiative for Community Empowerment is the community wing of the Indian Society of Emergency and Cardiac Nurses that aims to empower communities through nursing interventions and initiatives. So the main activities of NICE include healthcare education and promotion. NICE is providing various healthcare education programs to the community focusing on topics such as preventive care, nutrition, hygiene, mental health, etc. These initiatives would aim to raise awareness and promote healthy lifestyle within the community. And we are doing, means NICE is doing health screenings and preventive services. NICE organizes health screening and preventive services such as blood pressures, checks, diabetes screenings, immunizations, and cancer screenings. These efforts would help identify health risks and encourage early intervention, ultimately reducing the burden of disease within the country. And NICE act as an advocate for improved healthcare policies and resources within the community by working with local authorities, policymakers, and healthcare organizations. And NICE aims to address healthcare disparities, increase access to healthcare services, and ensure that the community needs are met. Besides this, NICE establishes outreach programs to reach underserved populations such as homeless individuals, low-income families, and elderly citizens. These programs might involve providing basic healthcare services and health education and connecting people to appropriate resources and support networks. Besides this, NICE also play a crucial role in disaster preparedness and response within the community. Nurses could be trained to provide emergency medical care, coordinate relief efforts, and offer support to individuals affected by natural disasters, pandemics, or other emergencies. Overall, NICE or Nurses Initiative for Community Empowerment would prioritize community well-being and healthcare empowerment by focusing on education, prevention, advocacy, outreach, and disaster response. And NICE could positively impact the health and resilience of the community it serves. So, in today's session, as you all know that we have conducting it in the Zoom with a limited participation. The same session is conducted or organized through the YouTube. Okay, so you know that the organizers took great pain in organizing this event. So we request every participants to take this session as in a serious manner. Try to learn from this. You can share your views how to improve our activities. Okay. So this session comprises of a post test, which will be in a series manner. The questions will be included throughout the sessions. So in between, the instructor will be asking you the questions, and you can see a Google form attached in the comment box, and it is pinned one. So it will be the first comment. So you can just pin that just go through that link, and you can submit your answers. And this program link will be active for 1 month, so that you will be able to attend this program anytime within 1 month, and you can get your certificates. Okay. And I just request everyone, please share this program to all your fellow nurses, and you just support our initiatives by subscribing and liking and sharing this program. And that's all. If you have any queries, just post in the chat box, or else you can reach at ISECN at isecn.adm@gmail.com, or you can WhatsApp to our number. It's an Indian number, 8287023206. Okay, so all the best. Try if you have. I'm just want to say that just try to attend this session throughout. And if you have any suggestions to improve, you are mostly welcome. So that's all. I'm just handing over the session to our speaker, Aziz. So Aziz sir, please carry on.
Thank you, Famir. Am I audible?
Yes, sir.
Can you hear me? Okay. Hi, everyone. Good evening, everyone. Nice to meet you all. So, as Famir said, my name is Abdul Aziz. I'm a registered emergency room nurse here in Ireland, and I have a special interest in simulation practice. So I'm focusing more on the high fidelity simulation, and we do a lot of the skill test and everything, skill sessions and everything in our hospital for our emergency nurses and doctors. So there are, as Famir has mentioned some of the informations about the session. So we are recording this session. So if anyone has any problem with the recording, please let us know. So we're just recording it for the purpose of posting it to the YouTube. Okay, and as Famir mentioned, I'll be asking 10 questions. That's a simple questions, like it's not a exam or anything like that. It's a simple questions. So I'll be asking, it's a kind of hybrid mode we are introducing this time, rather than asking all the questions after the session. So I'll be posting, you will see the sliders with the questions in between the class, and you can just note down the answer. So some of the questions are like option based. You will have like 3 or 4 options, A, B, C, D. Or some of the questions are true or false questions, and you'll have only A or B options. So you can just note down the question and note down the answer to the question. So when you fill in the form, Google form, you will be able to answer the questions. Is that okay? So we'll get into the business then. Let me just share my screen.
Yes, we are able to see that.
Okay, perfect. So basically, as I mentioned in the earlier stage, it's an application of simulation. So we are just going to see, like, I'm not trying to teach you all about what simulation is. It's just to give you an introduction or just an orientation about simulation in healthcare, how important simulation is, and what we can do in our own health settings, whether it is an ICU, emergency, or I know most of the participants are from the nursing background. So we're focusing more on the nursing background. So how can you implement kind of simulation? I don't mean you have to run a high fidelity, a full-blown simulation in your work practice. It will be a small session, like, they just giving you, just educating your colleagues about doing any procedure or anything like that. How can we scientifically do that? That was we are going to see today. Also, objectives of the study. So what we are going to teach, what I'm going to teach, what, how, why, when. So we are going to see some of the simulation techniques and everything. So I'll cover simulation, what simulation is, what are the modalities used in simulation, and what are the history simulation, how simulation emerged from the earlier stages to the new, what are the current innovations in simulation, and how can we run a simulation, what are the steps in running a proper simulation rather than a teaching session. So we are doing it by webinar, and hopefully I will finish it up before, I would say, 7:15. So simulation. So simulation is basically an educational technique that we use in the healthcare. So if you look at the simulation, a definition of simulation by Society for Simulation in Healthcare, simulation is a range of practices that share a broad, similar purpose to improve the efficiency and efficacy of medical practice. It's a bridge between classroom and real life clinical experience. So you all know, like, so we learn a lot from the nursing college or the medical college or whatever college we come from, all the other paramedical courses. we know we learn a lot of procedures in the classroom as well as the skill our laboratory there in the colleges, and we are directly going into the patient side. And so it's what simulation is. So we are trying to kind of replicate the actual hospital scenario or has hospital settings, whether it is an emergency, whether it is an ICU, whether it is a hospital, a general ward, and everything. So we are trying to replicate that hospital setting into our simulations. So that's what simulation is actually. So what is the purpose of simulation? What's important of simulation? So is the patient safety. So we need to, so I'll tell you more about the patient safety in the later stages. So according to GABA in 2004, simulation is a technique, not a technology. So you may have like all the facility to run a simulation, proper simulation, high fidelity simulation in your hospital, but it's a technique. There is no point in having all the technology, but you don't know how to run a simulation. So it's a waste of such money and everything, such money and your time and everything. Okay. And simulation is a safe learning environment. What I mean by safe learning environment, you can make mistakes in the simulation. So as I said, we are trying to replicate actual hospital situation, but you can make mistakes, like, you know. So if you are doing, if you are training someone, if you are conducting a simulation on, let's say IV cannulation, so you can hit everywhere if you want to on the mannequin. But if you are going to the patient side, we are trying to make sure the patient is safe and you are doing it in a proper way. That's a safe learning environment. There is a chance of mistake. You can make mistakes, and we learn from the mistakes. But if you go to the hospital side, if you go to the patient side without any training or anything like that, so you are harming the patients. So by simulation, we are aiming to reduce that harmness. So this is a video about Adelaide, one of the colleges in Adelaide. Just to give you an introduction about the simulation, what simulation is, what high fidelity simulation is. I know most of you might have participated in some kind of simulation. So I don't mean the simulation should be like in a proper simulation suit. You'll watch that in this video, but you know, the PLS, that's a simulation. Basically, that's a task trainer, that's a mode of simulation. So there are various modalities of simulation. So we'll see how does the proper simulation, high fidelity simulation runs. That's what I want to introduce to you. Like, you know, if it is new to you, some of you might have experienced this kind of simulation in your workplace or in your college. I'm just giving you an idea how we run a proper simulation. Is it okay? So I will play the video for you. If you have any problem hearing the voice or anything like that, just let me know.
Welcome to you. My name's Adam. I'm the director here of Adelaide Health Simulation at the Faculty of Health and Medical Sciences. It would be my privilege today to take you on a bit of a VIP backstage tour of our...
Can you hear the voice?
Yes, sir.
Simulation facility. Just to give you a bit of background, what we're about to go and see is almost like a pretend hospital. And this is where we teach our students of medicine, nursing, allied health, and so on, how to become safe practitioners in the future. But everything you see is pretend, okay? So we might see we're going to go to an operating theatre, we're going to go to a birthing suite, we're going to see actors that look like patients. They're not real, so you're very safe. So come with me and we'll have a look. One of the things that I'm super proud of as the director of Adelaide Health Simulation is that our facility is currently the only accredited facility for learning and teaching in Australia with the Society for Simulation in Healthcare. And we think that's pretty cool. One of the questions I often get asked is, so when does simulation education begin for your students? And the truth is, it begins pretty much straight away. So we purpose-built this facility in 2017, and an example of early training in simulation is something perhaps you might not think about, but things as simple as how do we shower our patients, or how do we attend to their activities of daily living. So this is one of our facilities where we learn how to brush patients' teeth, give them a shower, and of course attend to their bathroom needs. If you head down a little bit further, one of the other spaces I'd like to show you is our pharmacy. So this pharmacy is filled with pretend medication. So you would imagine, as a clinician, when you're learning, the decision of what medication to prescribe, how do you administer it safely, how do you observe the intended effects or the side effects, is difficult. So what we like is when our students attend the hospital to do this for the first time in a real patient, they've done it in simulation plenty of times before, and that's really the purpose of what we're doing. Let's head now to our exam system. So I'm just going to pause and spend a little bit of time here, if I may. Learning in simulation is intended to learn in a very safe environment. So we really encourage our students to make mistakes so we can guide them through on their journey. But at some stage, we need to make sure that they are safe and competent to practice, and we need to check their learning. Now, you might be used to exams being something you do in writing. In healthcare, we still do written exams, but one of the things that we like to do is what's called an OSCE, or an Objective Structured Clinical Exam. And this is where you come to simulation and you actually act out, if you like, what you're meant to be doing. So our students get to tap onto the computer system that you'll see outside of every room. And when they do that, the instructions for what they need to achieve inside the room are activated. But what's really cool is everything that happens in this room is recorded, and the student can also access that at home and have a listen. So come on inside and let's meet one of our simulated actors. Dr. Gluck, hello. So Sam is here today as one of our examiners. Lottie, hello. So Lottie is a professional actor and she's one of our simulated patients. And in simulation, often people think of the mannequins that we use, and I'm going to show you one of those shortly. But we believe here that using professional actors is an amazing way of helping our students learn how to build rapport with patients, consent, and give real life skills in building communication and empathy. So this looks like a real hospital, I hope you feel. If you have a look at the back here, we've got things like working oxygen or pretend oxygen. We've got medical air, working suction, a medical record, and you can see Lottie's vital signs on the vital signs monitor there. So the students will come in for their exam and they will actually engage with what appears to be a real patient, and all of that's being recorded, and the examiner's in the corner there marking them so we can give them feedback. So how's your care been in the place today, Lottie? All right?
It's been really good.
Very good. Thank you for everything you do. We'll be back to see you later. So come on now, we're going to head to the storeroom. That sounds like a bit of a strange place to go, but I did promise you a backstage pass. So we're going to head now into the storeroom. And just like a hospital, this is where we keep all of our equipment, all of our syringes, needles, dressings, suture equipment, but it's also where we store and maintain our mannequins. Now, human patient simulators are like robots, if you like, or computers. And Martin is one of our simulation technicians here who is working on one of the mannequins. I wanted to show you inside just to show you how complex these mannequins are. So they have heart sounds, breath sounds, they can talk, they have pulses, we can do CPR, we can do chest drains, all sorts. So it's like a mini robot. And of course, I just introduced you to an actor, but there's a lot of things that we can't do on an actor that we need to do on a mannequin. So here's the storeroom. Now I'm gonna just warn you one more time, things are about to get a bit more interesting. We're gonna go to a birthing suite and an operating theatre and a geriatric ward. So there is going to be some fake blood and other things. So just to warn you, but let's carry on and let's get to the exciting stuff. So we're going to start in the birthing suite, but there is actually a live class going on, and I'm not kidding you there actually is. So we're just going to go and spend a couple of minutes in here, and I'd like to introduce you to a good friend of mine, Lucina. So head on in. I'm really sorry, guys. Mannequin Lucina.
Hi, Adam. How you going?
I'm good, Lucina. How are you?
I'm doing great. I've just had a beautiful baby.
Yeah, a boy or a girl?
A little boy.
Congratulations. How are the students today?
Yeah, lots of students.
They're doing a great job. All right, well, I'm sorry to interrupt your class, and we'll be back to see you later.
Okay, see you
Okay,
later.
bye. Take
Bye.
care. All right, let's head out of here. Thank you, everybody. And now, let's come around and meet some of our medical students. Hello. How are you going, Fergus?
Yeah, well,
Very good. Sorry to interrupt your session. So this is 4 of our medical students who are in a competition nationally at the end of the year called the Emergency Medicine Challenge. And what I'm really proud of here is they've actually written their own scenarios and they're doing their own learning using simulation. So what is your scenario today, Fergus?
So this scenario, we have a young gentleman who
Yep.
has a small bowel obstruction, secondary to adhesions,
Yep.
and we're currently managing him with inserting a nasogastric tube, decompressing the stomach, and we'll also set up an IV cannula and giving him some fluids.
That is one awesome looking mannequin you've got there.
Yeah, it's very interesting.
All right, well, enjoy, guys. Sorry to interrupt you, and we'll see you a bit later. All right, let's head on now down to a really important aspect of our education, I think, and we've talked about the fact that we have infants and birthing, but we live in a population that is aging. So one of the things that I feel quite passionately about is that we need to ensure that our education covers care of the older person. So we pay particular attention to geriatric care and end-of-life care. And so here is, who have we got here today? What are they? Graham and Graham and Mavis. So our students can really learn to be empathy and communication skills with the older person and talk about some of the more complex areas of end-of-life care and become quite comfortable with that, which is important. All right, we've got 2 more spots to go, so I'm going to head over now. Thank you so much. I hope I didn't wake anybody up. All right, let's head on through here. All right, Michael, how are you going?
Good, Adam. How are you?
Good. I'm just taking some people on a tour. Now, this is really where the simulation magic starts to happen. And this is where it becomes quite technologically involved. So what we're in now, if you could imagine this was a theatre, we are backstage with the stage manager and the lighting crew. This is where everything gets controlled on the mannequins and the lighting and the vital signs, and it's all by wireless technology from the computers into the operating theatre here. So the next place I'm going to take you to is the operating theatre, and we'll see what Michael's created around there. You'll notice as we wander past that the nurses and surgeons are scrubbing in for the case, which is of course what we do in real life. And in simulation, we try and recreate everything. So that includes scrubbing, gloving and gowning. And now, just to pause for 1 second, remember that all the blood is fake, but we're going to go into our operating theatre. Hello, Dr. Gluck and Dr. Boyer. Hi. How are you doing? All right. I'm just taking some guests on a tour, and I wanted to finish here in the simulation suite. So what operation are you doing here today?
So we're just doing open periumbilical hernia repair.
Very good. So you could imagine as a student of the health professions, coming into an environment like this for the first time can be incredibly stressful. So we're very privileged to be able to educate our postgraduate and undergraduate nursing students and medicine in a simulated environment and let them know what it feels like to wear the heavy gowns and the hats and the goggles, which can be quite difficult. It is quite warm, isn't it? So this is one of our most complex suites. We use the HPS anaesthetic mannequin, which is an asset that will allow us to actually deliver anaesthetic gases and be monitored on real equipment. So this means that we can also provide simulation to a very advanced level to postgraduate learners. So that is, we meet our students as undergraduates and we started showering and brushing teeth, and we can simulate right through to very complex cases like surgical procedures and anaesthesia. So I better let you 2 crack on with it.
You could do with a hand.
Yeah.
You'd like a hand?
Yeah.
Well, I better go and scrub in. It has been a pleasure meeting you. I hope you've enjoyed the tour, and I really hope we get to meet in person one day. Thank you for your attention.
So that's the main. So the thing is, like, to talk about simulation, it's a lot of learning theories involved in the planning of simulation and everything, but it will be boring for you. That's why I included some of the videos of the simulation so that you can see, like, what are the advancements of the simulation, what do I mean by simulation, and what are the things we need to see, like, what I mean. So now we are going to see, like, what are the importance of simulation. So as I said earlier, simulation is directly linked with patient safety. So this is a very good article from WHO 2017. So if you look at the thing, so WHO says patient safety is a fundamental principle of healthcare. That's all we know. So services that are unsafe and low quality lead to diminished health outcome and even to harm. Is self-explanatory. I don't need to tell you about how should our nursing care should be, or the doctor's care should be, or the healthcare should be. So if you look at the survey, according to a new study, medical errors are the 3rd leading cause of the death in the United States. In the UK, recent estimates show that on average, 1 incident of patient harm is reported every 35 seconds. So if you look at the statistics here, these are the well-developed countries in terms of the medical equipments, in terms of the medical infrastructure and everything, in terms of the simulation also. So if you look at the numbers, the 3rd leading cause in America is like medical error. And if you see the another statistics in the same report, it is estimated 421 million hospitalization takes place in the world annually, and approximately 42.7 million adverse events occur in patient during those hospitalization. So approximately 2/3 of all the adverse events happen in low and middle income countries. This is the main point there in the WHO mentioning there, how we have to improve the health system, how we have to enhance our practices to safeguard the patient. So as I said earlier, patient safety is our paramount importance. While we are giving, whether it is a nursing care, whether it is the medical care or from any paramedical personnel. So we have to see, like, how can we prevent any error happening to patients? There comes the importance of simulation, basically. So simulation means we are doing the proper procedure or anything. We are going to practice in the actual clinical situations. That's what our aim is. So some of the hospital may have simulation in your hospitals or in your hospital, the colleges and everything, but some of the colleges might not have proper simulation. But we don't need a full-blown high fidelity simulation like the one we watched in the video. So it has to be like a skill training. It can be like a skill trainer. It can be like a standardized patient. There are some modalities we can deliver the simulation, so that we will see in the later stage. So a little bit about the history of simulation. So basically, we know that in the medical healthcare, so we see we were using the medical simulation for a long time. So if you look at the history, if you Google the history, before 900 BC, Susruta, our own surgical doctor, we call it, from India, he has been teaching people about the sutures and everything. Okay, so but the simulation is well implemented in the aviation industry. If you look at the aviation industry histories, there were a lot of fatal incidents from the plane crash and everything. So they somehow developed a system of training pilots, and they have to undergo, like, every year they have to undergo a simulation. So it is simulation in the simulator atmosphere, so that they can improve the safety of the flights and improve the safety of the pilots. So it was implemented in 1929. First flight simulator was implemented in 1929. It was called the Blue Box. It was made by a person called Link. So it was a kind of cockpit controller he built, and he used this controller to teach his brother, and he was able to fly the flight without any proper flight training. That's how good his system was. But it was a person from America. So, but it was only used by the amusement part, just for the entertainment purpose. Then they had a lot of flight accidents and everything. And finally, the government understood the importance of simulation and everything, training and everything. So they adapted his technique, and they adapted his the Link Blue Box, and started training the pilots. So if we look at the medical field, the first mannequin used for medical training was in 18th century. It was actually by a obstetrician, basically. So what happened is, his name was Gregory in Paris. So he made a model of a human pelvis and a dead body of a child, dead baby, actually. So he used this to train the new gynecologist or the obstetrician about the safety delivery and everything. So that improved the rate of that reduced the rate of errors happening during the pregnancy. That time it was in 18th century. But the simulation was very slowly adopted by nursing it was in 1990, one of the colleges from USA, they adopted one kind of a little mannequin, a doll-like structure, to teach their students about the nursing care and everything. But if you look at the modern era of the mannequins and everything, it was only by 1960 you may have heard of lateral. The lateral technology, they make a lot of this kind of equipments for the simulation. So in 1960, one of the doctor, he just presented a paper about the importance of airway care. So he was mentioning about the halted jaw lift technique. So adopted by this idea, Mr. Ledel, he was actually a what to say, like, play think maker. Basically, he makes a lot of play stuff, you know what I mean? So that the dolls and everything, he was a doll maker at that time. So encouraged from this presentation, he started making a kind of, the mouth-to-mouth mannequin where we can give mouth-to-mouth breathe. Then eventually they just put a spring into the chest so that we can do the CPR. That was the origin of our mannequin, the CPR mannequin we see at the moment in the earlier stage. And in 1968, Dr. Michael Gordo introduced something called a cardiology training mannequin. So it was basically just to teach the cardiology students about the blood pressure, about the rhythm and everything. It was called Harvey. It was called after his professor Harvey. And in 1960, Dr. Howard Barrows, one of the neurology student from America, he was just watching his professor teaching his students. So he was one of the students. So what his professor used to do was, while students were examining the patient, he used to sit there and watch them doing the examination. But often it can disturb the patient, whenever, I go to the patient, I take the history, and you go to the patient, and the third person go to the patient, do the same clinical examination, do the same neurological examination. The patient can be a bit frustrated from all the repeated questions and everything. So what he recommended was a standardized patient. So a standardized patient is a kind of an actor who will be telling you all the symptoms and everything, but you are the physician, you are talking with the patient, and the patient is an actor, a trained actor. They will give you all the symptoms and everything as of a patient, and you try to understand the symptoms and everything. You try to treat the patient in a simulated way. That's what a standardized patient is. So he introduced this in 1960. If you look at the modern era simulation settings, it was only by 1990, Dr. David Gava and team, he used simulation in patient safety and clinical management. So that's a little bit history about the simulation. I know this is a very dry topic. It involves a lot of learning theories and everything, but I'll try to make it as interesting by showing you some of the videos so that you can have an idea what it is. So I'm going to play the next video. Let me know if you have any problem watching the video.
Welcome to simulation at Bakersfield College Nursing Skills and Simulation Lab. We do simulation in nursing because research has shown that when students participate in simulation, along with the learning they do in their classrooms and the learning that they do in the clinical facilities, it helps improve their confidence, their competence, their communication skills, and their teamwork. This is important for nursing students because we want them to have a chance to go out and not be anxious in the clinical setting when they are working with patients and nurses, and be able to do skills and give medications and nursing care safely. So the idea behind simulation is we create a safe space where things are confidential. If a student makes a mistake, we talk about it in our debriefing and talk about ways that might prevent that in the future, how they would do things differently. And the students are coming up with those ideas themselves. And they know once it's discussed in the debrief, it does not go anyplace else. So they feel safe trying things that they think are right, whether it might lead to the best outcome for the patient or not. The other thing that we find that simulation helps with is patient safety. And so they are able to come in and practice things over and over again with patient safety in mind, coming in a room and making sure that the bed is down in the lowest position, the rails are up, There's nothing on the floor that a patient who is able to get out of bed might trip on, and those sort of things. And so it allows the students to practice patient safety, practice communication skills, walking in a room, introducing themselves to a patient, letting them know what the plan is for the day, developing that therapeutic communication and that therapeutic relationship with the patient. SIMS brings all of that to students so that they can combine that with what they are learning, be able to take it to the clinical setting, and be able to be safe practitioners of nursing. Simulation is vital to nursing schools right now because of the lack of clinical placements that we're finding, not enough places to put our students, and we need more and more nurses. And so we find that simulation is a very good solution for that problem, and gives students a chance to practice scenarios that they might not see in the clinical setting because they happen less frequently, but they can still practice them and know what their response would be and be able to respond appropriately. So simulation is vitally important to nursing students. The students really enjoy simulation. They feel like they are learning. It's very concentrated learning, and it is in a safe environment. And they take those skills and take them out to the clinical setting with real patients, and the patients benefit from what the students have learned in simulation. So thank you for helping us celebrate Simulation in Healthcare Week.
So we can give you a link to all these videos so that you can watch it in the YouTube to get a better idea, better video quality. So basically, so if you look at the video, when you were watching the video, the whoever is presenting the video, they were also mentioning about the patient safety part of the patient care. So that is very important. That's why we run most of the simulations in the healthcare. So when the COVID hit, there were a lot of lag, there are a lot of gap between the training theory part and the practical sessions in the hospital. So when the COVID hit, there were no trained personnel in the hospital, rather than, other than the person who were already there, the doctors or the nurses. We were not able to train anyone from the original patient settings. So where comes the importance of simulation? A lot of developed countries identified this knowledge gap because the whoever is in the colleges, they were out of colleges for like a year or two, and there was a gap between when they go to the, let's say, if a nursing student is in third year of the college and they are not going to college, not getting an exposure to the patient care for 2 years, and they are suddenly starting their practical session after the COVID wave hit. So what happened is there was a gap of knowledge. So a lot of advanced countries or the well-developed countries identified this gap, and they started implementing the simulation suits, the simulation practice and everything into their practice, so that a safe learning environment can be made, and so that the students can be learned from those safe learning environment. So bit about learning theories used in simulation. I know we are really going slow, I would say. So learning theories, these are the kind of basic principles involved in planning a simulation basically. So it's easy to watch a simulation in the YouTube, or it's easy to be involved in I don't say it's easy to be involved in a simulation, full-blown simulation. But the thing is, if you watch a simulation, it is interesting, but there's a lot of background works to be done to plan a simulation. That's what we are going to see a little bit. We are going to see about that thing. So learning theories used in the simulation practice, basically it's all the educational theories. You know about Maslow's hierarchy of needs, and we use Kolb's experiential cycle and Bloom's taxonomy. These are the kind of adult learning theories we used in the simulation. So if somebody is from the college background, someone is a tutor in our participants, they might know these theories very well. So I'll just go through a little bit about the theories. Okay. So you all know like Maslow's hierarchy of needs. So from the education perspective of view, you can see like from the pyramid, and education is the lowest one: physiological need, safety need, belonging need, esteem need, and self-actualization need. So what we are going to see in the Maslow's hierarchy of need is our motivation. So something called intrinsic motivation and extrinsic motivation. So I'm not going to talk about that in detail because it will be very boring to you. So, and the second one is Bloom's taxonomy. What Bloom's taxonomy? This is adapted from the Bloom's taxonomy. This is not the original the Bloom's taxonomy. So it's adapted. It's just a newly developed version of Bloom's taxonomy. So what Bloom's taxonomy is about cognitive domain. Bloom's cognitive domain is called. So basically, the lower remember, understand, apply. That part is kind of lower order thinking, and to analyze, evaluate, and create is higher order thinking. What I mean by lower order thinking, let's say, if I give an example of a 40-year-old man with a heart rate of 150, you know that is tachycardia. You know what I mean? You know that is tachycardia. So where does that belongs to in the Bloom's cognitive pyramid? Is the remember stage. So it's the very early stages in our cognitive, in our thinking pattern. So we are just trying to remember what we have learned from the colleges. We know heart rate of 150 in a 40-year-old man is tachycardia. You know what I mean? So if you go through that, it's a vast topic. I don't want to take all your time about detailing these things. So we'll go to the main theory we use in simulation, that is Cobb's cycle. Basically, Cobb's was an educationalist. So he developed a kind of a cycle of education. So this is actually adapted from Cobb's cycle. This is not proper. This is not the proper Cobb's cycle. This is adapted from the Cobb's cycle for the simulation education. So there are 4 stages in the Cobb's cycle: concrete experience, reflective observation, abstract conceptualization, and active experimentation. It's hard, but if I explain to you what it means, it's easy to understand. So concrete experience, what does it mean? In the concrete experience stage, a learner actively participate and experience simulation. That's what it is. So the learner is, if I'm the learner, I'm going to actively participate in the simulation. So that brings us up to the second stage, that is reflective observation. So in this stage, a learner reflects back on their experience. Debriefing allow learners to reflect on their activity. So after the simulation, they are just reflecting back to their own practice. How did they do? What did they do? What should I have done differently, or what can be done in the same manner to improve the patient care? All those kind of things. So it's basically reflecting onto our own practice. Okay, then we go to the third stage of the learning curve. So that is abstract conceptualization. In this stage, a learner learns to think critically about a given situation and helps to formulate concept and plan behavior for future event. So what does it mean? Basically, so we have attended a simulation. We just reflect back on our practice. How did we do? How can we improve and everything? And we are thinking about when we have to go to another simulation, the same simulation the second time, what can be done differently? So that's what the third stage is. And the active experimentation stage, that's the fourth stage. In this stage, a learner put in their skill from previous experience, and the cycle of experiential learning resumes. So if you look at the curve, so we have attended a simulation, we have attended an educational session, we just reflected back to what we have learned from the simulation, or what we have learned from any educational sessions, whether it is a webinar, whether it is a classroom session. We just are trying to see what we have learned from that. Then we are trying to improve what can be done the next time. So it's mostly applicable on the simulation, basically. So if you look at the classroom, we are not going to see like what can I do in the next sessions. But in the simulations, we'll be thinking about what can be improved in the next simulation, and you are putting all the skill learned from one simulation for the use of second simulation to make a better simulation next time, to make a better participant next. So that's about the learning theory. It's a very boring topic, I would say, but I'm just testing the little bit theories of the simulation. So now we go to the steps of simulation planning. We all watched 2 videos. I have more videos to show it you, but if you look at the video, like, you know, the nurses are doing, the doctors are doing a lot of procedures on the mannequin, standardized patients, and high fidelity simulations. But to plan this kind of simulation is very hard. There's a lot of background works to be done to make a successful simulation. I'm just going to touch a little bit about the steps of simulation planning. So first one is goal of simulation. So what is goal of simulation? Goal of simulation is educational needs and priorities of learner. So for example, if you want to teach your students, or if you want to teach your colleagues about a procedure, let's say IV cannulation, that's an educational need. And so you identified the need, or the colleague has told you, oh, I need to learn about suctioning of an endotracheal tube. So so that's the learner's need basically. So we are going to plan a simulation on that in a safe manner rather than practicing on the patient itself. That's what it means, like in the goals in the simulation. So if you look at the goal of simulation, we use an acronym, SMART acronym. So goal of simulation has to be specific, measurable, achievable, realistic, and timely. What is specific? Specific role, as I said in the example, IV cannulation. So we are going to teach IV cannulation. That's our specific in the goal. M stands for measurable. So how do we measure the IV cannulation performance? So we have to observe the colleague, or we have to observe the students doing the IV cannulation. We have to see how they're going to do the procedure. Are they doing it in a correct way? So that's what measurable is. So whatever simulation we plan, it has to be measurable. We cannot say, like, you plan a simulation and it can't be measurable after 5 years. You can't do that, because it's a learning method basically. So we have to teach the students. We have to evaluate our simulation session. So the third one is achievable. Is the goal achievable? We have to make a simulation. We have to have a topic for the simulation that can be achievable through the simulation. Let's say IV cannulation, for example, IV cannulation, same example, IV cannulation. It can be achievable. So you give them training, you watch them doing the procedure, you demonstrate them, re-demonstrate, so you'll see it can be achievable. And realistic. So one of the goals of simulation is realistic. It has to be realistic. You don't need to run a simulation. You don't need to plan a simulation which we don't use in our own health settings. So IV cannulation we always use in the hospital. So that's the simplest example I can give you. And timely. So how long are we going to do the simulation? That's what timely means. So in order to achieve this goal, we have to have a time period so that we can implement the simulation, and the students or the colleagues or the nursing students or the medical students, they can all learn from the simulation. That is goals of simulation. Second one is subject matter. So same, like, for example, the same example, if you take IV cannulation. So subject matter in IV cannulations, where to put the cannula, what are the veins we use, what all are the veins we can use for the cannulation, what are the advantages, what are the disadvantages, what are the complications arise from the cannulation. That is the simplest example I can give you about the subject matter. But if you are running a full-blown, let's say, cardiac arrest, that's a vast topic, so you have to consider that in practice actually. And the third one is learning outcome. What I mean by learning outcome is, so the same example, if we go back to the same example, IV cannulation, our learning outcome is the student has to learn how to insert a cannula safely in a patient without any complication. That's one of our learning outcome. So any of the simulation we run here, we may have 2 or 3 learning outcomes, so that we need to see, like, the people are achieving the goal of our simulation. As I said, there's a lot of groundwork, the background work going on to plan. So we need to make sure learning outcomes are met after the simulation. That's what our aim is. It's not a test. We are not assessing their knowledge most of the time, but we are just seeing how do they perform in a realistic situation. If they go to the hospital, let's say if you are doing a simulation on the cardiac arrest, and the people have experienced this simulation, and if they go to the hospital setting, a ward setting, if someone goes into cardiac arrest, they know what to do, like, because they practice it in the simulation with most likely the same, like the real life scenario in the simulation. They know what to do. That's the learning outcome. So learning outcome is also very important as the goal of simulation. So this is interlinked, basically, goal of simulation and the learning outcome. And the next one is material and resources. So whatever material you use in a simulation. Let's say if you're going to use, if you are going to teach someone about, let's say, endotracheal suctioning. So you need to have that endotracheal suctioning tube in your simulation, rather than telling them like, oh, this is the endotracheal tube. We insert the tube like this, we pull it back like this, and how long we need to suction, and what will be the complication, what are the preparations and everything. So instead of telling them what it is, show them what it is. That's what a simulation means. So if you have a patient, if you're going to train a person on, let's say, endotracheal intubation, you may need a ventilator, actual ventilator, or a dummy ventilator. You will need an ET tubed patient. It could be a mannequin, not a patient, I would say, a mannequin who is endotracheal, who has an endotracheal tube in place, and you will see all the vital signs on the monitor. So we try to make it realistic, same like the ward settings or ward atmosphere. That's what we do in our practice here in my hospital. So timeline, what is timeline? It's different from the goals timeline. So timeline is how long are we going to run a simulation? That's what a timeline is. So it could be like 30 minutes, it could be like 20 minutes. We'll have a little bit pre-brief, 5 minutes or 2 minutes pre-brief that we'll see in the later slides, and you will have the actual simulation part. Then we do a debrief. So debrief is the main important part of any simulation. The roles and scripts. So how are we going to run the simulation? We have to have a properly written scripts about the simulation. Then only if I wrote a script and I got sick and I couldn't go for the simulation, so someone else can use my script to run the simulation. That's how important script is. So we need to have a proper script for any simulation. And the feedback or debrief. We'll talk about debrief in the later slides. These are the basic steps of simulation planning. So we discussed this already, goals of simulation. Here comes your first question. So question number 1 is, what is M stands for in SMART acronym? Your options are A is mentionable, B measurable, C mechanical, D money. You can just note down the answer there. You can just note down the options. Question number 1, this option, and you can fill it in the Google form in the later stages. Modalities of simulation. What are the different kind of technique we can use in the simulation? That's what modalities means. So we have a lot of modalities here. If you look at the screen, role play, mannequin, hybrid simulation, standardized patient, virtual reality, augmented reality, computer-based simulation, task trainer.
Excuse me.
Yes, yeah.
We have to request the participants don't post the answer in the chat box.
Okay, yeah.
Thank you.
Okay, to all participants, they might have heard that. Don't post your answer in the chat box. You use the link to select your answer, and you can post it in after the 10 questions. Okay. So I'm going to go a bit fast here. So these are the kind of different techniques used in simulation to do teaching. So what role plays? Role plays, the learner takes up someone else's identity. So what it means is a nursing student, let's say nursing student takes up the identity of a proper nurse. So you'll have a patient, you are talking to the patient. It's a simulated environment. Your patient will be your tutor or your examiner. You'll be talking to the patient and try to understand the history and everything, symptoms and everything. You're trying to treat the patient. That's what a role plays. So the second one is OSCE. You might have heard of OSCE, Objective Structured Clinical Examination. So OSCE requires learner to demonstrate specific skills and behavior. So some of the OSCE sessions will be like, you will have your, I know most of the nurses going to UK and all, they do this OSCE examination there. So you will have your examiner there, and you will have either a mannequin, either a role play, either a patient, standardized patients lying on the bed. You will be asked to do a, let's say, Glasgow Coma Scale assessment. That's what it means. Like, and they'll be assessing you on that, your skills. How do you do it? And how do you perform in those kind of clinical scenario? Now we have hybrid simulation. Hybrid simulation means 2 or more modalities are used in the same simulation. That means we have like something called a task trainers. These are, so I'll show you the pictures of task trainers. You may not get what task trainer is. So if you look at the pictures, the first picture on the top left is a nurse, a nursing student trying to put an IV cannulation. So that particular mannequin part, that arm part is used for performing a procedure. So we call this kind of equipments task trainers. We are training a task on that thing. If you look at the second photo, someone is doing ear assessment. The photo down below, someone is doing a focus scan, ultrasound scan on the chest. I think it's chest. Looks like it's chest or abdomen, whatever it is. So these are the kind of, and if you look at this, is I think it's an airway mannequin. So if you look at the task trainers, so we are trying to give the students an opportunity to train the task, train the procedure in a simulator environment. Okay, so with the standardized patient, let's say we have a standardized patient. What is a standardized patient? Standardized patient is a paid actor, an experienced actor who will be mimicking a patient's symptoms and everything. And if you want to put a cannula into that patient, you will be using the task trainer to put in the cannula. That's what hybrid simulation means. And the standardized patient, as I mentioned earlier, it will be a experienced paid actor or experienced actor who will be mimicking, who will be acting as a patient, and they, if you talk to them, they will give you all the symptoms they experience, all the history, what are the medications they are taking, and you are trying to grab all the details from the patient and make your own diagnosis and try to implement your care to the patient. Virtual reality, you all know about virtual reality. We'll have a video about virtual reality in simulation later on. So use of virtual reality in the simulation, that's what virtual reality means. Augmented reality means if you're running a simulation, you will have different types of augmented reality set up by different companies. So the thing is, the atmosphere, let's say if you are trying to do a simulation about an operation theater, let's say you are doing a simulation of the theater, you will have the walls mimicked as your operation theaters. You will have the big screen or around the room, so that you will feel like you are actually in the operation theater. That's augmented reality. You might have noticed that in many of the news channels and everything, the people are, the whoever is presenting the news and everything, they might be flying in the flight or they are in the ship, that kind of augmented reality stuff. Also, we have a lot of augmented reality companies. They provide augmented reality into the simulation. So we'll see that later. The next one is task trainer. I explained that earlier. The mannequins we use for a specific task, whether it is IV cannulation or arterial puncture or any chest drain insertion, to do the scan or to do the thoracotomy, whatever, or intubate, those kind of stuff. We discussed OSCE, and computer-based simulation is the same. We use computer software to do a simulation. That's what computer-based simulation is. So these are the things we discussed earlier. Virtual reality is the use of computer technology to create an interactive three-dimensional world that has a spatial presence. So we will feel like we are in the actual settings. We'll watch a video about that later on. So this is the top one on the left. That's basically an augmented reality simulation. That's a company. I don't want to mention the name of the company. It's not a promotional video anyway. And if you look at the photo down below, that's a standardized patient. The patient, the actor is acting as a patient, and I think this medical student asking questions about the symptoms. So that brings us to the next question. That's our question number 2. What is role play in simulation? So what is role play in simulation? Options are use of task trainer and a simulator patient in a simulation. Option B, a model that represents a part of the body. Option C, a trained actor who is trained to play the role of a patient. Option D, a learner takes someone else's identity. So what you mean what did you understand about the role play in simulation? What is role play in simulation? These are the 4 options. Option A is use of task trainer and a simulator patient in a simulation, a model that represents a part of the body, a trained actor who is trained to play the role of patient, a learner takes someone else's identity. So you can just note your answer there, and you can fill the form later, or you can fill the form now in the chat box. And our question number 3 is, what is called a task trainer in simulation? What is called a task trainer in simulation? Your options are a computer-generated 3D world used within simulation, use of virtual reality in conjunction with a mannequin. Sorry, there's a additional with there. Option C is a model that represents part of a human body. Option D is an examination that may be formative or summative in nature. So what is called a task trainer in simulation? Option A is a computer-generated 3D world used within simulation. B, a use of virtual reality in conjunction with a mannequin. C is a model that represents part of a human body. D is an examination that may be formative or summative in nature. So I hope that's okay. Now we'll go down to concept of fidelity. So we talked about modality in the earlier slides. So now we go to the fidelity. What fidelity means? Fidelity is the amount of realism you can implement in a simulation. So there are 3 types of fidelity. One is your physical fidelity, one is your environmental fidelity, and the third one is psychological fidelity. What is a physical fidelity? So physical simulator elements closely mirrors real life situation. So your physical modality would be high fidelity mannequins, the mannequin which can blink, which can sweat, which can urinate. There are high technology mannequins available at the moment. So those are your physical and your physical equipments. Let's say if you are running a simulation about an ICU scenario, you'll have a ventilator nearby, or your oxygen port, your suction port, all those kind of things. Those are the physical we use to replicate the actual clinical scenario. That's what physical fidelity is. Environmental fidelity, environmental elements closely mirrors real life. So the environment. So if you are trying to replicate an ICU, we are trying to introduce an ICU environment for the simulation. That's what environmental fidelity is. How realistic we can make a simulation. That's what fidelity is. So environment is how well we can replicate our own work environment. And the psychological fidelity. What is meant by psychological fidelity is it's the emotion and sense of presence you feel by attending a simulation. So is that actually correlating with your actual workplace? That's what psychological, your emotion, you feel taking care of a patient, let's say cardiac arrest, and how do you feel to run to be involved, to be a member of the cardiac arrest team in the ward or in your work setup. And we are trying to replicate the same. You can see how realistic it's actually a mannequin. So you can all see like it's a burn injury with, you can see in the down the bottom photo there is an open fracture. So this something is called knowledge. We are trying to replicate the actual patient so that it can be realistic as possible for the learners. So if you look at the photos, I don't have much photos of this. So this is one of our one of the simulation we ran for our emergency doctors and nurses. It was a case of burn injury. So they couldn't intubate the patient. So we can do those kind of difficulties with the mannequin. It's an advanced mannequin we have here. So the patient is tracheostomized. You can see the ET tube coming from the throat. So if you need to engage the learner into the simulation, you need to go with high fidelity most of the time. That's a kind of realism about when I speak of fidelity. Is that okay? Now here comes the next question. Question 4. In simulation practice, modality and fidelity is same. It's a true or false question. So answer A is true, answer B is false. So you can select one of the answer. In simulation practice, modality and fidelity is same. Is it true or is it false? Is that statement true or false? So we have discussed about different modalities, and we have discussed about fidelity. You can note down your options, or you can just use the link to answer your question. So question 5, high fidelity simulation mannequins are always needed to run a simulation. Is this statement true or false? High fidelity simulation mannequins are always needed to run a simulation. True or false? Okay, that's our 5th question is. So I'm not going to this topic. We are already out of time. So clinical assessment tools. So these are some of the tools we can use by running a simulation. If you want someone to assess one of your colleagues or our students, to nursing students or the medical students, to assess a patient using ABCDE tool. So this is what we use, ABCD. These are the multiple tools we can use to run a simulation. Next comes debrief. So okay, I'll tell about debrief here. So debriefing provides an opportunity to explore and understand what happened during an event or experience, discuss what went well, and identify what changes can be made to improve the experience better next time. As a post-experience analytic process, debriefing is discussion, analysis, and evaluation of an experience or an event. So basically what debrief means is debrief is the main part of any simulation. So you have your, if someone has attended a simulation and they're going to reflect, you might have remembered the COPE cycle we talk about. So you are going to see like, how did I do? How did I perform? What could have been done better? What could have been done in a different way? So whoever is running the simulation instructor will be helping people to understand how did they do, could have done better, what could have done different way. That's what debrief is. So if we are planning a simulation on something, if you're planning a half-an-hour simulation, so it's better to have most of the time given for the debrief rather than the actual simulation. So you'll be making a lot of mistakes. So that can be corrected in the debrief. So debrief is the important element in the simulation, most important element in the simulation, not the simulation part itself. So this is the simulation process. So we'll just go through the simulation process and we'll try to end the session very soon. So preparation, a pre-brief, simulation activity, debriefing, reflection, and evaluation. These are the simulation process. You remember the COPE cycle, how we learn from our experience. So preparation, what is preparation? So you're giving the learner all the preparatory material. Let's say if you're trying to do, we'll take the same example of IV cannulation. So what you're going to do, you're giving your students or you're giving your nurse all the information about how to do the cannulation, where to put the cannula, what are the blood vessels we can use to cannulate the patient, or all those kind of materials you give them prior to the simulation, so that they can learn and they can have an idea what it is, what they're going to experience in the simulation. So your care plans can be your care plans, your reading material, case studies, your practice skills, your patient records, your completion of a pre-test or a quiz about something. So your lectures about cannulation, how to cannulate. So that is pre-briefs. That's the preparation. So if you go to the pre-brief, what is meant by pre-brief in a simulation? Pre-brief is just before the simulation activity. So it's an interaction between the simulation educator and the learners before the activity. So basically the instructor will be, you're going to do let's say, for example, we'll take the same examples, we'll understand better than cardiac arrest. You're going to participate in a cardiac arrest scenario simulation. So the instructor is introducing to the session. Basically, this is what we are going to do. And but some of the times, you don't tell them what are we going to do. It will be a bit of surprise for them. Not all the time we have to tell the participants or tell the learners what they are supposed to do in the thing. So if you are going to see how will they manage the cardiac arrest, you will be just telling them this is the patient and the patient will deteriorate, and then you do whatever you'll do in the clinical practice. So this might be a cardiac arrest scenario, so that they can do the cardiac compression, the airway management and everything, or defibrillation and everything. So not all the time we need to tell them what it is, but most of the time we tell them what is the aim of the simulation, what are the objects, how long would this last. You orientate them to the clinic simulation area. This is what your mannequin is. This is what you are. This is where you get the stuff. This is where your adrenaline is. This is where your ambo bag is kept. This is where your the IV cannula is kept if you want to IV cannulate, or your IO access is kept. All those kind of equipments, and the environment. And confidentiality. What is mean by confidentiality? Most of the time, this simulation will be the high-end, the high fidelity simulation will be recorded just for the educational purpose, so that these people can see their actions in the simulation. Sorry. In the simulation. So we have to tell them this is a confidential place. We are recording the video just to show you how did you do, just for the debriefing purpose, not to publish in the YouTube video. But there are some good few videos in the YouTube that will be they might have taken permission from the people who involved in the simulation to put it in the YouTube. So most of the time it's very confidential. We don't want to blame anyone. We don't want, it's just a learning opportunity. We don't want to blame anyone for making a mistakes. We learn from our mistake. This is as I said, this is a safe learning environment. We can make mistakes, and we have to learn from our mistake. That's what whole idea of simulation is. Then our learning objective, as I said, we don't need to tell all the time what our learning objective is. And expectation, what are we expected from what do we expect from them to be achieved? So fiction contract. So fiction contract is something like, so it's all kind of, it's not a real patient. It's a mannequin. So you will have that element of fiction in whatever you are doing in the simulation. So we just tell them, this is not actually a proper patient. So this is a simulator situation. So this can be fictions. And some people feel like, what I have noticed while running simulation is some people, they won't involve into the simulation because it's a mannequin. The mannequin cannot talk. Someone will be talking for the mannequin. Like if you ask the patient, mannequin is a patient. So if you ask the patient how you doing, so mannequin, someone will from the background will be speaking for the patients, like, oh, I'm feeling tired or something like that. Still, we don't feel that realism, as we get from the actual patient. So we just tell them this is a fiction. We are trying to teach you something, but it's just a training session. That's what fiction means. So recording, as I said, we'll record the session for later on. And evaluation method, etc. How are we going to evaluate sometimes it will be questionnaire, sometimes it will be evaluation checklist. How did they do? Like, let's say for a same example, IV cannulation. If you are doing a simulation of IV cannulation is not a full-blown simulation. It's just a task trainer, but still we need to evaluate. So what you're going to evaluate in that, like, did the student wear gloves? Did they clean the site? Was there any complication where we are putting the cannula? All those kind of stuff. It's a checklist. We can use multiple evaluation tools. So debrief, again, it's very important. It's one of the important thing in the simulation session. So all simulation-based learning activities should include a planned debriefing process. So when we plan a simulation session, we need to include how we going to evaluate this thing? How we going to run a debrief after the sessions? There are multiple debrief tools we can use while running a simulation. So this debriefing process may include any of the activities of feedback, debriefing, or guided reflection. So basically, what is feedback? Feedback means whoever is running the simulation, they are giving the students how did they do, how they're giving the feedback to them, how did they perform in the simulation. It's a one-way kind of communication. So whoever is running the simulation, they will give them how did they do, what could have done in a better way, all those kind of stuff. It's the same steps we are discussing in the debrief. And the second one is debrief itself. So debriefing is a kind of interactive session. So we'll ask the students how did they feel, and what happened during the scenario, what could I have done better in a different way. All these same questions again, like, I'm not mentioning it again and again. So that's what feedback is. It's a bilingual, like, it involves the participants, it involves the instructor too. So, and the guided reflection. Guided reflection is a kind of, we encourage them to explore the process of critical thinking, and promotes learners to link between the theory and knowledge. So we're just giving them ideas. So they have learned all this kind of stuff from the college, and we are giving them an idea how to implement this in the practical world, how to include this theory, how to implement this theory into the practical session. So debrief, give enough time for debrief. These are some important steps about debrief. It promotes transfer of knowledge. So it's an open-ended questions. Ask them open-ended questions and give them a pause to answer, and learner-centered approach. So it's basically it's more focused on the learner rather than who is instructing. So these are some of the debriefing adjuncts we can use in the debriefing. So it's video debriefing. So we have recorded all the sessions and we are going back to the recorded video to show them, oh, this might have been done in a different way, or this is what you did wrongly, or this you did very well. You know what I mean? So that is video debriefing. Debriefing software, same. It's a software, basically it's a software about the debriefing, but they will use the same video to showcase any particular point. So that the software help us to bring a particular point to tell the students, oh, this is what you did wrong, or this is what we have to. So by doing wrong means I'm not trying to blame, we are not trying to blame the learners or accuse the learners, but we are just letting them know this could have been done in a better way. We don't want to hurt anyone's feeling. That's what we say in the pre-brief. Basically, it's a learning opportunity, it's a safe learning opportunity. You can make mistakes and you learn from your mistakes. We don't usually say like, this was done wrongly. So we may ask a different kind of questions to let them understand, we did it wrongly. So the next one is co-briefing and a debriefing script. Debriefing script, same like the script we discussed earlier. We have to have debriefing scripts. Most of the American Heart Associations, the ACLS and everything, they have their own debriefing scripts. Co-debriefing. Co-debriefing is basically you will have another instructor. So if I'm running the simulation, I'll have another instructor. So they'll be giving their input about the simulation so that the learners can get a different kind of idea from a different person. So these are some of the tools we use in debriefing. One of which is Sharp tool. Sorry. So if you see that before case set learning objective, after the case, how did it go? What went well? Why? What didn't go well? The same questions I discussed earlier. Review learning points. Were your learning objectives met for this case? What did you learn about your clinical technical skill? And if you look at the last point, plan ahead. P stands for plan ahead. What actions can you take to improve your future practice? That's what debriefing is. It's the same questions, the same thing we are discussing. So we need to see, like, whatever simulation we are conducting, we need to see the people are getting some knowledge from the simulation. Otherwise, there is no point in running, wasting everyone's time. So peers is another tool we can use for debriefing. So here comes our question 6. I think that's the end of our discussion. We'll see some videos after this. Hopefully we can close by, I would say, maximum 10 more minutes, if that's okay with everyone. So question 6 is, what is the most important element in a simulation session? Options A, pre-brief. Option B, actual simulation part. Option C, debrief. Option D, evaluation. So what is the important element in a simulation session? Pre-brief, if it is pre-brief, or is it actual simulation, or is it debrief, or is it evaluation? So in situ simulations, I'll just touch about in situ simulations. We are already running out of time. Anyway, in situ simulation is the practice of using simulator scenarios in a clinical environment itself rather than in a training facility. So the kind of simulation, the high-fidelity simulation I talked about earlier, it was all in a lab, in a simulation suite. We plan simulation, we run the simulation. But what is in situ simulation? So we are bringing this mannequin, whatever the thing is, we are bringing this equipment into your workplace, into my workplace, to run a simulation. Let's say cardiac arrest. If you want to run a cardiac arrest scenario in a particular ward, in a medical ward, so you just take a bed, a patient bed, and you put a mannequin there, and so you just tell them, you just tell the nurses we are going to run a simulation today. So they will come and assess the patient. So patient is in cardiac arrest, and they will start doing the simulation, and you assess them how they are doing. So most of the hospitals and most of the institutions are more keen on in situ simulation at the moment rather than the laboratory simulations or simulations, just because we will be more familiar with our own environment, and we know where to find the steps and everything. So learners are placed in their familiar environment. It is based on creating a safe environment to experience and practice managing a scenario which is high risk in rare clinical care, such as cardiac arrest, as I said, and to consider appropriate action should the real situation arise. So what we're doing is, let's say a new graduate nurse is joining a hospital. They haven't experienced any cardiac arrest in the college life. They haven't seen how to run a cardiac arrest. They might have learned about cardiac arrest in the theory part, AHA, and some of the hospital give them like BLS, ACLS training. But even if you go to the BLS training, it's just kind of a task training. If you are in the real situation, you may forget that. You may feel like, or you may go blank. You know what I mean? So what we are trying to do in situ simulation is you are replicating that cardiac arrest scenario within your ward, so that you know what to do, where to find the stuff, how to call for help, and what are the equipments we need, and where are the equipments kept, all those kind of situations. So the most of the institutions are introducing in situ simulations at the moment rather than the full technologically advanced simulations. And the technologically advanced simulation costs a lot, multi-million dollars kind of it works. So that is the end of it, I would say. Let me see. Yeah, now we will see some of the videos. Is that okay? Was that clear to you? Let me see. Can anyone respond? These are the modalities of simulation. Someone was asking me. So we are already running late. Role play, mannequin, hybrid simulation, standardized patient, virtual reality, augmented reality, computer-based simulation, task trainer, or OSCE. So I'm gonna play some videos about newer innovations in simulation so that you can have an idea. So all of these videos are taken from YouTube. So if you just
Aaron, let's try 12 milligrams adenosine rapid IV push.
Giving adenosine 12
video
milligrams.
audible, Mr. Famir.
Yeah, it's audible.
Oh, yeah, there it goes.
He's not breathing. I think I still feel a pulse. Actually, I can't tell if it's his or my fingers.
Andre, start CPR.
I feel one either.
Starting compressions.
Sonia, defibrillate 200 joules.
Charging. All clear. Shock delivered.
Andre, speed up your chest compressions to 100 to 120 per minute.
Speeding up to 100 to 120 beats per minute.
Okay, so if you look at that video, that's a virtual reality used in simulation. So that's another virtual reality video. These are the new innovations in the simulation.
Hi, nice to meet you all. So my name is Jack Hoggle. I'm founder and medical director of Oxford Medical Simulation. We're a virtual reality medical training company. And the point of this is to take everything that we do in physical simulation. I'm a physical simulation instructor by background, and taking that in to make it more accessible, increase throughput and increase accessibility of simulation to allow you guys to focus on the binaries of human interaction, communication and teamwork, while we can get the basics of technical and non-technical skills down to save you time and to save your institutions money. That is the basic focus of what we do. The way we do it is using fully immersive virtual reality. So this is about giving you the option to have student groups, giving them access to certain amounts of simulations, and you can do this on a user basis or on an institutional basis in terms of giving nurses and doctors groups of scenarios. And we do scenarios focused on doctors, focused on nurses, focused on medical students, and on pediatrics as well. So it's a virtual reality platform to cover all of those different angles. And then the user can choose to go in the scenario, and when they're in there, as demonstrated by Jenny here, they are in a virtual reality scenario. She is now completely immersed in that virtual world, and you'll be able to see that on screen in the background. So I'm going to ask Jenny to do a few things. Jenny, can you just move around the room first of all, and just have a good look around? So Jenny's moving around here, she's having a good look around, and she's got everything there that you would do in a normal.
Okay, guys, so if you can search that video on the YouTube, I would say, like, we are really running out of time. So this is called Oxford Simulation. This was built by Oxford company, so Oxford Simulation Healthcare, I think Oxford Simulation Healthcare company. So basically, you can see, you just search that in the YouTube, you can see what it means. So other will be giving all of our time. And this is another video.
Lenses used, right,
this
so
is
the students
this is called HoloLens.
the image directly in front of them, but they can also see the external environment.
So everything from anatomy, where students can learn about the GI tract, right through to different patient scenarios where we can bring a condition to life in the form of a real person that they can seat in a classroom and walk a full 360 around and observe. So holo patient means that we've got a patient who's experiencing some sort of health crisis. So that could be everything from domestic violence right through to stroke or myocardial infarction. We place that person in the room, and the students see the room just as it is, and then they can walk around that patient and they watch a 15-second loop of a different scenario, assess, stop, ask questions, and then we exacerbate that.
So our next question number 7 is, in situ simulations are planned and organized in one's own settings. Is this statement true or false? Question is, in situ simulations are planned and organized in one's own work setting. True or false? Next question is, simulation scenario designed have maximum impact if scenarios reflect the clinical environment. Simulation scenarios designed have maximum impact if scenarios reflect the clinical environment. Is it true or false? Is the statement true or false? The next question is, fidelity within simulation have 3 environments that they reflect. These are, fidelity within simulation have 3 environments that they reflect. These are, option A, physical modality and psychological environment. B, physical, environmental and safe environment. C, physical, environmental and physiological environment. So 3 environments. Question 10. Learning outcomes should always be disclosed in the pre-briefing section. Learning outcomes should always be disclosed in the pre-briefing session. Option A, true or false. Is again a true or false. Is this statement true or false? We have to always discuss our learning outcome in the pre-briefing session before we run a simulation. Is it true or false? Some of the references. So that ends our simulation. Thanks again for participating in today's webinar. I know it's a kind of dry topic. I just want to give you an idea about simulation, how simulation is important in the safety of patient and the learning. How did you all guys feel about it? That's okay. Thank you. So some of the people are saying thank you. It was something different anyway. Yeah. So if you go to YouTube, and you'll see a lot of videos about the same, if you put in augmented reality or virtual reality in simulation, you'll see a lot of videos in the YouTube. So just go and watch the videos, or else we can send you the videos I used in my presentation. So you will have a clear idea about simulations. I know for some of you, it will be a new thing to you. I don't know what's the situation in India about the simulation, or there are people from other different countries. I don't know how their situation there in regards to the simulation education. It's all in the developed country also. It's kind of evolving at the moment in most of the developed countries. But if you look at the USA or Australia, it's well developed. So, and as I said earlier, since the COVID pandemic, people really understood the importance of simulation education. Anyway, thanks for your time. We'll see with another topic later on. Thank you.
So thanks for watching our session. So hope you all have enjoyed our webinar. If you have any queries, as I mentioned earlier, you can just share, or you can just chat to us in the chat box, or you can just WhatsApp us to our WhatsApp number, or you can email us. So this all will be pinned in the chat box. Okay, thank you. So once again, I just want to tell you one thing. You all have to attend the post test, then only you will be getting the certificate. You have to score minimum 80% marks for getting the certificates. Okay, if you are not able to get 80% mark on a stretch, no need to worry. You can attempt 1 or 2 times or as many numbers as you want to score the marks. Anyway, this is not meant to test your knowledge, but we just want to make sure that you are attending the session and you are going through the session and you are gaining some knowledge. Okay, so you can watch the video again and again, and you can discuss with your friends and whatever try to learn and try to attend the sessions. Okay, thank you once again. And if you want to get this program regularly, we are planning to conduct this webinar regularly. So just try to subscribe our channel, and you can like this video, and you can share with your friends. And thank you once again for your support. Thank you.